Gauteng Department of Health has assured the public that despite losing a significant amount of medical staff, the quality service will be rendered at the Charlotte Maxeke Academic Hospital. The hospital currently has 403 vacant positions at 364 nurses, 12 other medical staff and 27 allied staff that are needed. According to the department, the primary reason for medical staff members' departure is due to better remuneration elsewhere. Joining us this morning in our studios, like Leanne said, it's the MEC of Health in Gauteng, Qedani Mahlangu. MEC, good morning to you and welcome to Morning Live.
Good morning and thank you for having us.
Thank you very much indeed for coming through. Now, please elaborate for us, MEC, the reasons for medical staff leaving for better remunerations elsewhere. Is the department not paying them enough?
One of the things the public should know that there is no crisis at all. The time at which these doctors and nurses, particularly doctors, were leaving is the time when it was a changeover, or doctors, new registrars were coming on and the others, the old one were leaving the system. So hence the discrepancy of the number you're seeing there. As we speak, there's additional 25 new doctors at Charlotte that has taken responsibility. The nurses, we continue to replenish the numbers because some nurses that are over 60 are leaving the system due to natural attrition. So therefore, all our nursing colleges per annum, we're producing more than 1,000 nurses who come to the system. Of course, they come at different times depending on the vacancies. So what I also want to assure you is that, yes, indeed, people will leave for different reasons, that they want to go to public, that they want to establish their own private surgery. They prefer to be on to work for themselves than to work for the department, because if truth be told, that there's a lot of patients that our doctors and nurses are servicing, and they're doing so diligently. And therefore, it's not uncommon, not only in South Africa, all over the world, for doctors and nurses to be feeling the pressure, because indeed there's too many more people are getting sicker, and more citizens need to be seen in the hospital, and also medical aid are squeezing the benefits, and on the basis of that, more people, including those who have got medical aid, find their way into the public health system.
So in terms of the Charlotte Maxeke Academic Hospital, are you saying that there is no heavy workload on the staff currently?
There is a heavy workload on all our staff across the board. The heavy load is in the nature of the job of what doctors and nurses are doing, and it's uncommon. It's not uncommon for doctors, when the registrars old one come in, leave, and a new one come in, that there will be a gap of about a week or two, or even a month. And as we speak now, as I said, there's about 25 new doctors that have taken their responsibilities, more than 100 nurses. We also do not have a long vacancy period that we'll have when you're looking for someone in finance, or when you're looking for someone in other responsibilities in the department. When we're looking for a doctor or a nurse or a pharmacist or a dentist, any of those strategic core business of the skills we need for the department, we've got an open-ended advert where it allows us to interview professionals much more quicker, and be in a position to employ them on the basis and of course depending on how many days notice they must serve in their previous employer.
All right, now MEC, you're saying that you were able to bring about some doctors on board at the hospital. So in terms of service delivery, everything is still in order? Services
continue to be rendered across our hospitals, and we can assure you, we can even provide you with the numbers in maternity. For instance, they are able to deliver about 800 babies per month, and Charlotte is much more than Telemukharani. They are delivering more than 1,000 babies a month. So across the board, services continue to be delivered. And most importantly, what we really need to try and do, which we are doing, you know that we've employed about 50 doctors from Cuba in our primary healthcare services, that in the clinic and in the community healthcare center, as part of ensuring that hospitals are not overburdened by cases that can be treated at a clinic level. And I believe that the work we are doing is really going to give support to all the citizens as to our health professionals.
All right, now you've just mentioned Telemukharani Hospital in Vosloorus, and I wanted to touch on that. But what we're seeing at that hospital, in the Charlotte Maxeke Academic Hospital, is it the pattern that is prevalent in all the hospitals in the province, the staff departure?
As I said, the registrars would be affected somehow with the registrars because they are part of the training platform of Qedani Mahlangu and Charlotte. Remember, we've got clusters. Clusters are anchored by Qedani Mahlangu, Charlotte, Steve Biko and George Mukari. They are supporting a number of hospitals and supporting a number of clinics under them. Therefore, whenever there is a gap in the system, even if there's no gap, you have doctors, senior doctors and consultants who leave the academic hospital to go and support the regional hospital like Telemukharane, like Sebokeng, like Kopanong, like Tembisa and all of those. So there is really no crisis at all, and we are doing all our best. As I said, we have compared to what is happening in the UK, to what is happening in other well-established democracies, well-functioning health systems. What is happening in South Africa is not abnormal at all.
Yeah, and we do know that many nurses in the province are close to a retirement age. How is the department going to deal with that? Are you looking at perhaps training more nurses?
We are training more nurses, and what is really encouraging that our nursing colleges are located at Qedani Mahlangu, George Mukari, and many others, including one is just here close to SABC, like here, Helen Joseph. We are training more nurses. As I said, per annum, we're introducing more than 1,000, producing more than 1,000.
So the interest is still there for
yeah, the interest is still there, particularly young people. But what we are also trying to do is encouraging young people to become midwives, to specialize after the 4-year basic training, to specialize to become a midwife, so that we can have specialties in helping women to deliver, to specialize in ICU, to specialize in trauma, to specialize in mental health and all of that. And that's what we are really focusing on, working with the Nursing Council and the National Department of Health.
All right, MEC, thank you so much for your time.
It's a pleasure, and thank you for talking to us.
Thank you very much indeed. There you have it. That's the MEC for Health in Gauteng, Qedani Mahlangu, reassuring the public that good service at Charlotte Maxeke Hospital will continue despite the fact that a lot of experienced staff members left the hospital for greener pastures, as the MEC said. Well, we're taking a break. When we come back, we'll give you the 7